There's a killer among us. Diabetes is a deadly disease, but it can be managed with medication, diet, by understanding what it is and how to control it. According to diabetes.org, nearly 10% of Americans are afflicted by this disease and is the 7th leading cause of death in America. According to the Centers for Disease Control and Prevention, 86 million Americans, or 1 out of 3 people, have prediabetes, and 9 out of 10 of those people don't know it. First off, what is diabetes? Diabetes is a medical condition where the body is unable to regulate the levels of glucose in the blood. There are 3 types of diabetes. I'm going to be talking to you today about 2 of them, types 1 and types 2. Type 1 is formerly known as juvenile onset, and it's when the body produces insufficient amounts or no insulin at all. That's a lifelong disease. Type 2 diabetes is the more common type of diabetes. It's formerly called adult onset, and is where the body produces insulin, but the body is resistant to the insulin it produces. Type 2 diabetes, doctors will tell you, is as a result of living a sedentary lifestyle and having a poor diet. Insulin is a hormone that the body produces to let the sugar that's in your blood know where to go. For those with type 1 diabetes that don't produce insulin, it's introduced to the body by an insulin injection. A lot of times type 1 diabetics will have a pump that's constantly monitoring and injecting insulin throughout the day. Diabetes is diagnosed by one of 2 methods. One is a fasting blood glucose, where you fast for 8 hours, and if you have a blood glucose of over 126 milligrams per deciliter on 2 separate occasions, you're considered diabetic. Now, therapeutic range is 80 to 110 milligrams per deciliter. The other method of diagnosing is the oral glucose tolerance test, and that's where you ingest sugar water, and it's measured, your blood glucose is measured 5 times over the next 3 hours. If you have a blood glucose of over 200 on 3 separate occasions, you're considered diabetic. Second off, I want to talk to you about what some of the symptoms are. Hyperglycemia and hypoglycemia are defined as hyperglycemia being high blood sugar, hypoglycemia being low blood sugar. They each have their own set of symptoms. Hyperglycemia's early symptoms can include excessive urination, excessive thirst, blurred or double vision, fatigue, headache, and some of the later symptoms can be fruity breath, nausea and vomiting, shortness of breath, weakness, or even coma. So some of the later symptoms are obviously a little more severe. Hypoglycemia is when your blood levels are too low, oftentimes brought on by too much insulin injection. And some of the symptoms of hypoglycemia are rapid heart rate, double or blurred vision, hunger, shaking or trembling, tingling and numbness, fainting, seizures, and even comas can occur. Now, if diabetes is left untreated, some serious complications can arise in that your body starts breaking down fat, and the metabolic reaction of that creates poisons for our body, and you can die. So thirdly, I want to talk to you about how to monitor and medicate for diabetes. Finger sticks, I'm sure you've all seen, are when you stick a needle, a little lancet in the fingertips, and you have a little digital device that lets you know what your blood glucose is. Really easy and really fast. You'll see a lot of people oftentimes know their own bodies and their symptoms, so they'll carry around a candy bar or drink some orange juice if they feel their blood sugar is getting too low. A lot of the medications that people use, type 2 diabetics and type 1 diabetics, are insulin. And there's many different types of insulins, long-acting, short-acting. Type 2 diabetics are often prescribed an oral medication at first. Depending on how they react to that, they'll either stay on the oral medications or they'll be prescribed insulin. But most of the time, doctors will tell you that symptoms and the disease can be alleviated by, again, lifestyle and diet for type 2 diabetics. And the Mayo Clinic states that the best way to reduce the risk of diabetes-related conditions is to choose a variety of nutritious foods. So we've talked about diabetes. I've explained to you the types of diabetes, what some of the symptoms are, what hyperglycemia is, what hypoglycemia is, what happens if diabetes is left untreated, how to monitor and medicate. And I hope that you guys have gained a little bit of knowledge by the research that I've done and come out of this knowing a little bit more about potentially some of the loved ones that you might have in your life that are diagnosed with diabetes. So again, I thank you for your time.